Hey, thanks for joining us today as we are covering the process of starting baby on solids foods and baby-led weaning.
Yeah, we recently went over 4 signs that your baby might be ready to start solid foods, and now we're going to jump into what it actually looks like to start giving your baby real food.
In case this is your first time meeting us, I'm Sarah. I am a board-certified OBGYN and a first-time mom.
I'm Kurt. I'm a board-certified pediatrician and first-time dad.
And we are the Doctors Bjorkman. Welcome back. As we mentioned, this episode is all about starting solid foods for baby, and we're specifically going to take the time to share some of the medical research about baby-led weaning, the potential risks and benefits, and then share some of the key things to consider when starting solids and baby-led weaning with your baby.
Yeah, now we don't have time to cover even close to all that you're going to want to know about this topic, but hopefully this episode serves as a solid primer to get you started and also gives you some of that confidence you're looking for when going to start solids with your baby.
We also need to mention that there isn't complete agreement about the best way to start solids for babies. And so in addition to sharing some of the studies that have been done on this, we're going to take a bit and talk about what we did for our own little kiddo in hopes that our journey can help you when you are starting to figure out feeding your own baby.
Yeah, and before actually initiating solids for your baby, you're going to want to make sure that they're ready. And so if you missed our episode on that, go back and check it out now, and then come back and catch the rest of this one later.
You may wonder, what is baby-led weaning and how can there be controversy about how to feed a baby?
Yeah, so baby-led weaning is simply initiating solid foods or table foods in a way that puts the focus on baby, setting their own pace as they explore tastes, textures, colors, and smells. This is in contrast to kind of the other currently more popular methods of just starting babies off on purees and rice cereals.
Yeah. It's important here to note that there is room for a middle ground, kind of based on your comfort as a parent. There have been some concerns from parents and even pediatricians that baby-led weaning could potentially lead to more choking events or even nutritional deficiencies. But we're going to go into some of the research that has addressed these questions so that if you are considering baby-led weaning, you can do so safely and in as healthy a way as possible for your baby.
Yeah. There's also another term called BLISS, or baby-led introduction to solids, which is very similar to baby-led weaning, except for that it's a bit more formal and has some written and verbal instructions given to parents about how to prepare foods and introduce solids to their baby. We're going to use the terms baby-led weaning and BLISS interchangeably, but our hope is that either way, the information we share today will help you make your baby's introduction to solids as safe and stress-free as possible. Currently in the U.S., it's most common for families to start their baby with foods like purees, baby foods, or rice cereals. And there are mostly certainly some advantages to these foods, as they can often be purchased already prepared, which makes feedings pretty easy. They are often also fortified with things that baby could potentially become deficient in, like iron and zinc. And then they also pose a really low risk for choking.
So the goal of baby-led weaning is less on getting baby to eat the food that you give them, but it's really more on helping them develop a healthy and less pressured relationship with the foods they eat. And then the hope is this, in turn, may have some benefits for the child and the family as a whole. And in our case, we felt it was even more simple than going out and buying pureed foods or making some of our own.
Yeah. From all the literature we've reviewed in preparing this episode this week, there's really not strong evidence that baby-led weaning makes a big positive long-term difference for children.
Yeah.
But there is some data to suggest that babies who learn to eat solids with baby-led weaning practices, ate more fruits and vegetables at 2 years of age, that they may better learn feelings of fullness, that they have lower rates of obesity, and that they may have more varied diets in the future as well. Having said that, as I alluded to, the studies on this aren't particularly strong, and there can be many other factors that could lead to these outcomes in these children, aside from just how they learn to eat solids.
Right.
So if you're thinking about trying baby-led weaning or baby-led introduction of solids, you should really do it because it sounds like the best thing for you as parents and for your baby after discussing it with their pediatrician.
Yeah. For us, we chose largely to follow baby-led weaning principles because it was just easiest. We cooked dinner at home most nights, and so doing baby-led weaning just meant that hey, we gave our kiddo what we were eating, just kind of processed and cut up in a way that was safe for her to eat. And then the next day's snack was kind of what we had for dinner. So again, I kind of called it like lazy mom introduction to solids.
Now, there is also some research that baby-led weaning, or moms who chose baby-led weaning, had some positive effects, or at least correlations as well, like lower maternal anxiety, lower obsessive compulsive disorder scores, and lower eating restraints with higher conscientiousness in these mothers as compared to mothers who chose traditional weaning strategies. Now, of course, this isn't causal, but is just something that was seen in the moms who chose baby-led weaning.
For the families who are choosing baby-led introduction to solids, the next important question to ask, is what are the potential risks of baby-led weaning, and how can you do this as safely as possible?
Yeah. Now, as we mentioned earlier, there actually have been some concerns from parents and even some pediatricians that not using store-prepared fortified foods could potentially be a setup to lead to nutritional deficiencies in these babies, or that there could be an increased risk of choking. Now, however, with proper coaching, as occurs with the Bliss method, these risks from baby-led weaning have not actually been seen in studies.
A couple studies looking specifically at the rates of choking and gagging between infants who were fed standard purees and those who followed baby-led weaning found no statistical difference in rates of these symptoms between the two groups.
Yeah. Now, we also need to address the risks of nutritional deficiencies in infants who undergo baby-led weaning. So as you can imagine, if a parent is doing baby-led weaning and the foods they're offering are maybe not high-energy foods, or they don't have a lot of the nutrients that babies need, like iron or zinc, that are often fortified in the purees, you could imagine how these deficiencies could develop in these babies. And actually, some early studies about baby-led weaning saw that this did occur in some children.
However, if you are able to offer a variety of high energy foods to baby and are also using vitamin supplementation, which is really recommended for most babies regardless of their diet, these differences and nutritional deficiencies were not seen.
So now let's say your baby is somewhere between 4 and 7 months old and they are able to sit with great head control, they're showing interest in table foods, and they've had great growth with breast milk or formula. These all things lead to show that your baby is probably ready to start the first steps of trying real foods.
Yes. As we mentioned in our recent video about assessing whether your baby is ready for solids, now is a great time for them to try a slightly thickened liquid like some diluted rice cereal, a thin gravy, or something similar to show that they can get that little thickened substance to the front, from the front to the back of their mouth, so they can swallow.
Yeah. It's also a great time for your baby to get taste of foods that maybe they won't actually eat. This could be like sucking on a large piece of meat, or even something like a corn cob that still has some juice in it, but the kernels are removed, so it's not a risk for them to choke on.
When offering food to baby, don't be surprised if they don't take much at first. That is okay. And if they don't seem to like a food the first time or two, keep offering it. Remember that this is not about baby eating a lot or getting in a lot of calories. This is about baby practicing and learning to eat.
Yeah, these early feeds are really, again, all about building good eating habits.
Yep.
So start by offering a wide variety of foods. Try not to rush or hurry your baby, and even trying to find times to offer food to baby when they're otherwise happy. So this could be they've just had some milk, and so they aren't that hangry, hungry baby who's just starving for something to eat, where they can really just kind of focus on the experience of having food in their mouth and working on swallowing. And then also, please don't forget some basic safety rules that we're going to share with you next.
When it comes to safety, make sure to be thoughtful of baby's positioning. For very early simple tastes, it's okay for baby to be seated on a parent's lap, but as you start to transition to true meal times with baby, you're going to want them seated in their own seat, in a high chair or an up seat. You don't want to have them leaning back, which is why we would recommend not feeding baby in a car seat or a stroller.
Yeah. Also, never ever leave your baby alone with food in front of them. Remember, baby is still just learning how to swallow, and there may be times where even with the food they've seemed comfortable with before, could be a challenge for them on a different day.
Yeah. avoid potential choking hazards. So next week, we're going to share some of the most dangerous foods for early eaters, while also giving our favorite 10 foods for baby to start with.
Yeah. And finally, try to make sure baby is in an environment where they have as few distractions as possible. Again, they're learning a new skill, and they ideally can be as focused on what they're trying to do as possible while learning.
And having fun.
Yeah. Now the next step is to actually let baby progress to real meal times where they're eating table foods.
Yes. For us, we simply made these the times we were also eating. So maybe we'd do this for lunch and dinner, or breakfast and dinner, a couple times a day.
Yeah. Now, until baby is 9 months old, any table foods that they're given are complementary to their breast milk or formula feedings. What I mean by that is that these extra solids aren't meant to provide any substantial amount of calories.
Babies should still be getting the 24 to 30 ounces of milk a day to provide the complete nutrition that they need. And the solids they're eating are just for learning how to eat, while also gaining that exposure to new tastes and textures and even potential allergens.
Now, since we've mentioned allergies, I just want to take a couple quick moments to touch on the topic, which we're going to actually take more detail and cover in the upcoming weeks about.
Yeah.
But for this episode, there's really not medical evidence that shows that there's any benefit to avoiding allergens for babies in these first early months. And there's actually maybe benefit in exposing them to some of these potential allergic foods that it could potentially reduce their risk of developing an allergy to that food later. Yeah. Having said that, it's a good idea to introduce only one new food every 2 to 3 days so that if your baby has a reaction to a food, you know exactly which food caused it.
So if you're offering avocado on Monday, you would want to wait to introduce bananas until Wednesday. And then you could add in mashed chickpeas on Friday. So by the end of the week, you could be having avocado and hummus and a banana during meals as they are continuing to build those foods that they are safe with.
Yeah, exactly. And it's really important to also consider the situation you're in. So now for us, we don't have any significant family history of food allergies. We actually had some allergy medication in the house that's for infants, and we live less than 15 minutes away from a children's hospital if any serious event were to happen. So if you have significant allergies in your family, you should definitely talk to your baby's care provider before offering some of these potential allergic foods to them. Things like peanuts, tree nuts, egg, chickpeas, shellfish, dairy, wheat, sesame, and soy.
The final and likely biggest question that you probably have are, what do you actually feed the baby to start out, and how do you prepare it?
Yeah, so we don't mean to be a tease about this, but we're actually going to use our next episode to share kind of our 10 favorite early foods for babies, and then also kind of 13 foods that can be really dangerous to young infants.
Until next week, though, we have to mention that kind of the biggest help to us when starting to do this with Baby C's was a program website app called Solid Starts, and couldn't more highly recommend their app and website. We are not sponsored in any way. It's just a resource we use that we thought was really, really helpful.
Yeah, we ended up getting their like starting solids bundle, which I think costs right around $100. It's a one-time fee to get access to all sorts of resources online,
Guides,
their app, their guides,
everything,
and it doesn't expire. And so actually that like one-time investment, I think more than paid for itself in terms of like, it was just, we were able to use foods we had at home without having to go buy purees and other things. And so it just worked so well for us. Hopefully that's something that works well for you too if you can afford it. Otherwise, our next episode we're going to dive into just some simple foods to start with to give you guys a good head start.
We will see you next week.
Bye guys. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.